For the past 2 years or so, we at Force have been working quite closely with our client partners from all over the country and have been able to hear directly from them what the biggest challenges and pain points have been throughout this process for them. And so one of the most common challenges we hear is it's really difficult to meet that 1 year matched PROMs collection requirement. Typically getting the pre-op PROMs is not so much of a challenge, but a year is a long time and a lot can change in a patient's life during that time. The problem is if you're not collecting at least 50% of those eligible patients at both pre-op and 1 year, you're out of compliance. So luckily we have, a ton of experience with this, and we've gathered a few of the most effective ways that we've found through our clients to capture those 1 year collection rates. And so the first is really to keep patients engaged during that time for as long as you can, during their recovery, and educate them well in advance about what PROMs are, what to expect, and why it's so important to fill them out. We really see an impact from our clients that prioritize talking to their patients a little bit about these surveys in advance, letting them know, hey, you're going to get a reminder on your 1 year anniversary of surgery to fill this out again. It's really important for your doctor to see how you've done. It only takes about, 5 or 6 minutes. Stuff like that, we really see that extra quick education go a long way. Getting visibility into the patients that have not or are at risk to not fill out and complete their PROMs. This is huge because the earlier you can intervene, the better. And as Amy and I, we were just chatting before, a few folks jumped on. There are always going to be those patients that just don't want to fill out the forms, or they're stragglers, or they might need a little bit of an extra push to get there. And so having visibility into who those patients might be can be huge in terms of sort of getting around that. And finally, to review reporting regularly. So whether that's through your EHR, if it has that capability, or through, a separate digital solution to support PROMs collection, staying on top of where you stand regularly so that you can ensure you're on track is really important when it comes to, staying on top of all of this. The second most common challenge we hear is that data collection, extraction, and submission is time consuming. Time that honestly staff members often simply don't have, which is why it's so important to streamline this process wherever you can. We work with clients from all different types of hospitals, some with large teams supporting this, to some who really don't have anyone specifically, to dedicate to this. But the things we've seen work well for even the smallest of teams are to leverage technology that can extract the data and format it for you. Doing this manually is extremely time consuming, and especially if it's a larger volume of patients, trying to do it manually isn't really realistic or scalable. So utilizing also some form of digital submission from the patient level, so that as many patients as possible can submit their PROMs directly, and again, minimize that amount of manual submission that has to occur. So when we think manual submission, we're thinking pen and paper in office, calling folks at home and submitting on their behalf. All of that really adds time and inefficiency to this process. And one client that comes to mind here when we spoke had implemented iPads in their waiting rooms to have patients fill out their forms, thinking, okay, we're using technology, that's got to be a good thing. But what they found was that it was almost just as inefficient as paper and pen, because no matter the medium, still having patients fill out forms in person exclusively is just a slower process. And what's further, they wanted to establish some sort of responsibility on the patient's behalf for the pre-op forms, so that when that 1 year mark came along, patients had already been familiar with submitting their forms digitally from afar, and it wasn't a new process for them. And finally, establish and fine-tune standardized data collection workflows to reduce variability and ensure consistency where you can. I would say the vast majority of our clients say that it's really about the process here. And, most of the time, step one really needs to be setting that up and making sure that everyone involved is following that agreed upon process. And the last common challenge that we hear is just the lack of capacity and added burden on staff that this mandate has created. I don't think anyone in this audience would disagree with me that hospital resources are limited, which really just means that they have to be allocated strategically. We really know that some hospitals are very well equipped to take this to the next level, and others are just kind of trying to get by, and that's okay. And what we found really helps here for everyone is to provide training to staff and make sure that they have both the skills and tools they need to efficiently manage this reporting process. And listen, I know that this is tough to do. What we've heard from our clients is that it tends to be difficult for teams to follow new processes and adopt new ways of doing things if they don't fully understand what's at stake. So we found that taking the time to hold dedicated training sessions or Q&As to help folks, A, understand the importance of all of this, and B, feel confident that they have a solid plan in place to tackle it can be really impactful. Partnering with vendors that really specialize in prompt collection and reporting and do it well really works to streamline the process as well. How they would have been able to do this without, help from a third party that can bear the burden of the actual collection process with things like, different collection options or automated reminders. And finally, review the processes that have been set up regularly in order to increase efficiency and ensure that any learnings gained from this process are then used to optimize and iterate on existing workflows. So I can tell you that most of the clients that I work with are constantly talking to me about different ways of doing things, brainstorming, through challenges with me, asking me how other folks are doing things. And if there's one thing I can really say, it's that I think this is a work in progress for everyone. So adopting a flexible approach to all of this has been very for most that have been going through the process.